to help with immunization against coronavirus. I know there are a lot of questions about how RNA and DNA differentiates or how these vaccines work. So first of all, I would like to tell you that the mRNA vaccine has nothing to do with your DNA. Your DNA is in the nucleus of your cells, and mRNA vaccines or any mRNA does not enter the nucleus. So this claim that this vaccine will alter your DNA or do anything of that sort is completely wrong, and it should not be a basis for you to not get the vaccination. Dr. Hines, would you like to add to that?
Sure. A lot of people were upset with how fast these vaccines came out, but really ever since SARS and the Mideast respiratory syndrome, for the last 10, 12 years, they've been working on this technology to make these rapidly produced vaccines. And as Dr. Dhillon was saying, the messenger RNA is to make proteins. And so what they're fooling our cells to make are these proteins that will help protect against coronavirus. So that's, they've been working on this for a while, but it's a very safe vaccine.
So right now, we have two main companies that are providing these vaccines. Right now, one is Pfizer, which obviously a lot of physicians and hospital staff has received. The second vaccine is by Moderna, which is also got approval last week by FDA. So both vaccines, the mechanism of action is similar. Just like Dr. Hines said, it fools our cells to produce a protein, and that protein resembles the actual viral protein. So once that protein is in our system, our body starts to fight it and starts producing antibodies. Now, these antibodies serve as protection against when we come across the real virus or we are getting infected with the real virus. The dosing schedule is 2 doses for each of the vaccine, given 3 weeks apart. And so far, people who have received that I have known have not had any significant side effects. Main side effects are usually fevers, headaches, myalgias. Beyond that, everybody has been able to take it safely.
I think another thing to add, Dr. Dhillon, is the fact that there is no live virus that's being vaccinated against. And like you say, we are making antibodies against the protein that are being produced. So there's nothing like a live virus that's being transmitted. So it's impossible to get coronavirus from this vaccine.
Correct. Daniel, you have any specific questions?
Yeah, so what we're going to do now is I'm going to turn it over to Monica, if I can, for a minute, just to go through some commonly asked questions that maybe you can answer. And Monica can chime in as well as to some of the stuff that she knows. But if Monica can start some questions instead of we having a bunch of questions come in, I also want to impress on everybody that they're welcome to use the chat to ask any questions that you might have about the vaccine. Monica, if you can, before you do that, before you ask any questions, or after you ask any questions, actually, let's go through the questions. Then if you can address with the team, you know, how soon it's actually coming out for us, I think that would be helpful too. But if you can first start with any questions you might have, and if anybody has any questions, please put them on the chat and we'll make sure they get answered.
Okay. Hi, everybody. So some frequently asked questions are, the vaccines were developed at lightning speed. How safe and effective could it be? The physicians did a great job of answering that for us. I will add to that just a little. This information comes from CDC and other reliable sources. As they said, there has been rigorous and rapid study and development of these vaccines. They have been working on similar vaccines processes like this for years, which is why they were able to move so quickly with the COVID-19 vaccine. It is supported by the federal government's efforts to ensure the regulatory and oversight process was efficient and it was not bogged down by typical bureaucratic delays. It was produced applying all the ethical standards involved in traditional vaccine development. There were no corners that were cut. The data shows it is safe. We are losing thousands of people each day to COVID-19. Risk of transmission, especially for vulnerable populations, outweighs the risk of the vaccines and any complications that may arise. And we can't delay the therapy any longer when so many people are dying. Do you guys, physicians, have anything to add about it being safe and effective?
There's a question on the group chat about it being safe, and the question is, if you're allergic to peanuts, can you get the vaccine?
You can get the vaccine even if you're allergic to antibiotics, peanuts, and semi-allergic reactions to this vaccine have occurred is to the fat that surrounds the messenger RNA. And some people can't tolerate those lipids. That's the fatty coating of the messenger RNA. And that's what some people have reacted to. But allergies to other things will not prohibit you getting this vaccine.
Also, as far as the efficacy goes, when influenza vaccine came out, it was only 50% efficient, and we all took it. This is a vaccine which is 94% efficacy-wise. So the efficacy, or the vaccine actually works, is very high. So there shouldn't be any questioning on that.
Thank you. The second common question is, will this be a yearly vaccine like the flu? And the short answer is that we really don't know yet. We're going to have to learn more as the data becomes available over time. Dr. Dhillon, do you have anything to add to that about that question?
Right now, a lot of research is going into to see what kind of immunity we develop once we get infected by this virus. So most of the immunity that commonly when you're infected by coronavirus, you get something called cell-mediated immunity. In other words, your T cells are the ones that fight against the viruses, rather than actual antibody production. So we are still learning about this virus, and we may be in good news that the immunity is actually cell-mediated, which lasts lifelong, and we may not have to get this vaccine again. However, just as you said, we are still in the process of learning about it, because now is the time when a lot of people have gotten infected, and a lot of studies can be performed on them to see what kind of immunity actually these people have. Good news, like I said, is before also that people who were infected in February, March have not come back with recurrent infections. Some of them have tested positive again for COVID-19, but none of them have shown the severe signs and symptoms of actual infection. So that also kind of helps us a little bit, that probably the immunity lasts longer than what we are thinking so far, which is 3 to 6 months.
Okay.
Yeah, we really don't know how long the immunity will be, hopefully longer. And in terms of getting yearly coronavirus vaccines, that will depend on the virus and how it mutates and becomes resistant to whatever vaccination that we have. So like influenza, it's an RNA virus that mutates a lot, and who knows how it will mutate to continue. And most recently in England, there's a new strain that seems to be more infectious but not as lethal. But the people who are getting vaccinated seem to be protected against it, at least initially, but time will tell.
There's
Thank you.
another question. There's another question on the chat if we can get to that. Do any pre-existing conditions prevent you from getting the vaccine? And if so, what conditions?
There are no known pre-existing conditions that I am aware of will exclude you from getting the vaccine.
The only problem with it is the intolerance of the lipids. If somebody has had that, what seems to work is some adrenaline or epinephrine, which all the people giving the vaccine have on hand should a reaction like that happen.
In the guidance, we've also been told that if, for example, someone was given the flu vaccine, we would want to wait, that we would not want to give the COVID vaccine within 14 days of receiving the flu vaccine. Also, any patient or resident that received antibody treatment for COVID, they're asking that they wait until that treatment has been greater than 90 days before, but that's the only contraindications that I've heard. Did you guys, physicians, did you hear that as well about the flu vaccine and the antibody treatment?
I honestly have not heard much. I know that if you got the flu vaccine, you got to wait about 2 weeks before you can get this vaccine. As far as the actual, like you're talking about monoclonal antibody treatment.
Yes.
So if you have received the monoclonal antibody, those are neutralizing antibodies and they don't last long. They're supposed to act very quick within first, 3 to 5 days of an actual infection, and that's it. So I don't see, either way, you're going to give a monoclonal antibody to somebody who has gotten recently infected. So if you have gotten recently infected, you still have to wait 2 weeks no matter what from your diagnosis to get the vaccine. And that's the time when you get the monoclonal anyways.
Okay. Yeah, so anybody that is COVID positive in our buildings, if they are still on transmission-based precautions, they will not receive the vaccine at that time.
That's
Can you hear her? Okay.
Are there any other questions in the chat, Daniel?
Yes, there is. Another question is there any concern with getting the vaccine if pregnant or trying to get pregnant?
So there was a recent approval by, I think, ACOG or American Academy of Obstetrician and Gynecology to actually recommend vaccination of pregnant, lactating, or people trying to get pregnant. So far, again, we don't know what the future holds, but so far there has been no known contraindication or concern with vaccination of this group of people.
Yeah, as far as we know, there's not enough data to say that you shouldn't get vaccinated. And I'm sure as time goes on, we will find people who are pregnant who got vaccinated, but there shouldn't be medically any reason not to give this vaccine while pregnant.
Those who have had the virus, is there a specific time frame for that, 90 plus days or what?
So most of the recommendations are if you are eligible to get the vaccine 2 weeks after you have gotten infected. So after 2 weeks of your positive test, you're eligible. However, because of the way the things are, and we know that the immunity can last anywhere from 3 to 6 months, you can wait 3 months before you get the vaccine.
Yeah, what we recommend is for someone who's had the virus and recovered and has their own immunity to wait at least 90 days before getting vaccinated. And that's not a contraindication to the vaccine. And hopefully it will prolong their immunity against the virus.
Is there a waiting period of when you should receive the vaccine if you have had recent surgery?
No.
Not that I know of.
Okay, Monica, a few more questions there, more
Yeah, some other common questions, and this is probably one that's on a lot of people's minds is the vaccine going to cause long-term side effects? I know
We
that's
don't know. Yeah. I mean, the technology itself is pretty sound. It should not cause any long-term effects because the mRNA does not stick around in your system. It goes away. So the protein that you have formed after the vaccination also goes away. So the only thing that's left is the antibodies, which is necessary and which is what we are shooting for. So theoretically, I don't, there is no big concern from medical standpoint of any long-term issues. But, again, nobody can be 100% sure. Nobody knows. But based on what we know about the technology and based upon what we know we are doing, we shouldn't have any issues.
I got the vaccine last Friday, and other than a sore arm for a few hours, had no reaction at all. And as Dr. Dhillon said, I don't expect any long-term side effects to the vaccination.
great. Another common question, which I believe we have answered effectively, is it a live virus? We know that Pfizer and Moderna are not live viruses. I believe Johnson & Johnson and AstraZeneca are working on a different type of vaccine that may include a live virus, but the two that we have available are not live viruses. Another common question, as frontline healthcare workers, aren't we being used to further experiment on people to verify its efficacy?
Political question. Well,
Dr. Dhillon, you're very good at political questions because you're so straightforward. So we're going to count on you for this one.
Oh, really? You want me to shoot
Yeah.
them? Okay.
Shoot from the hip, whatever you got to say.
Whatever I got to say, you'll take it, huh? Okay. Well, no. The issue here is we need the frontline workers to continue to help these people. We cannot immunize the entire country. We will not be getting out of this cycle anytime soon. We will continue to see people with COVID-19 coming to the hospitals, coming to the facilities. There is no way to end this. So where do we start? We have to start and save the people who are going to help others. So that's where and people who can understand as to what is actually happening. If they tried to give this to a general population up front, half of the population or more of the population will not even show up for vaccination because it is very education. I mean, what we are doing right now is educating people and making them understand that it is safe. This is the technology. This is not going to hurt you in any way. It is going to protect you. But we cannot do it on a large scale population. I mean, there are so many anti-vaccine groups out there that you will not be able to do anything effectively. So this is the first time I think politically they're doing the right thing. Sorry, Danielle.
Yeah, as frontline workers, and even if I thought it was experimental, I would be in line to get it, given the number of COVID patients I see every day. And so, yeah, I'm willing to do anything to avoid that.
So short answer is it's not experimental and you should get the vaccine is what I'm hearing you say.
Yes.
We have a follow-up question, and one of them is, once vaccinated, will you have to still be tested in the facilities? Right now, our staff are getting tested twice a week, and will they have to be tested? And I don't know what the doctor's answer is, but I do know that CDC and public health are saying absolutely yes. So getting tested.
So vaccination does not protect you from getting the infection for about 2 weeks from what we know. So for at least 2 weeks after getting the vaccine, you are still equally, you can still get the active, you may not get the symptoms or anything, but you can get the infection. And if you have live virus, you are going to infect other people. So we have to continue to test you. Unless and until the actual prevalence of the disease comes down in the society, people working in healthcare facilities, especially in nursing homes and so forth, probably for another 2-3 months will continue to have to be tested regularly. Unless we prove every individual who is in the facility either has been vaccinated or has gotten infected naturally. I don't think so there's any way out of it.
No, and I just want to add, the physicians from CDC and IDPH also said that they don't know how the vaccine is working on asymptomatic people. So we still have to test, we still have to wear masks until there are more studies to show what the vaccine is doing for everyone. Nothing is going to change in our infection prevention and control strategies. We still have to keep testing. We still have to wear our mask and social distance and do all the things that we're still doing. And we will have to probably continue with all of those things, like Dr. Dhillon said, for several months to come.
I predict that after being vaccinated, you'll still maybe want to test them once to make sure that they are protected and have the messenger RNA protein antibodies. So that'll take a while. And I think in the studies, 5 or 6% of the people came down with COVID anyway after the vaccination. So there is still a failure rate of the vaccine.
Right.
So to follow up on another question, that followed up on the mask question. So we will be required to wear masks still in the facilities, even after receiving the vaccine. Another question is just to clarify, for the patients who are within their 20 days TBP, not sure what that means, due to testing positive, I guess that's isolation, they do not qualify for the vaccine. So I guess the question is, do they qualify for the vaccine if they are still in their 20 days of isolation?
Anybody beyond 14 days of testing positive is qualified.
Okay, great. You may have touched on this already, but in case you did not, I'm inquiring about taking the vaccine if a person has had anaphylaxis to medications for NSAIDs.
There is no contraindication for that either.
Yeah, medication allergies do not contraindicate this vaccine.
What if you've had allergic reactions to other vaccines?
That's a potential problem right there.
CDC says we
there's-
should monitor you for 30 minutes if you've had a serious reaction before.
Right, and they have epinephrine on hand if there's any reaction.
Yep.
Monica, any further commonly asked questions?
That was all of the commonly asked questions.
Okay, we just have another one that just popped up. If you've tested positive for the antibodies, is it still recommended that you take the vaccine?
Yes.
Yeah, what we've recommended people who have antibodies for, let's say, an asymptomatic infection, because of the long wait for some people to get the vaccine, that they wait at least 3 months before they get the vaccine.
We received a comment from someone. They received a letter from their children's medical doctor, their doctor's office, that they do not have regarding pregnant women taking the vaccine or children, and therefore this vaccine is not for pregnant women or for children.
I'm not quite sure why they're saying that, but as far as I know, children, nobody under 18 right now is going to be getting the vaccine.
And how about pregnant women? Again, that question came up.
They approved it last week for pregnant women.
I also know IDPH physicians just said for pregnant or lactating women that they really should just consult with their physician, their primary care physician, about whether it is safe for them, but they aren't, like you said, Dr. Dhillon, there's no contraindication at this point.
One of the answers you gave was that if you tested positive for antibodies, it is still recommended to take the vaccine. They'd like to understand why it is still recommended to take the vaccine if you've tested positive for antibodies.
So even if because we don't know how long those antibodies that you have naturally acquired will last. Right now, they have seen on an average 3 to 6 months. So if you are beyond 3 months of your actual infection, then take the vaccine. If you do not want to take the vaccine right now, that's up to you. But you do, yes, theoretically, you do have the protection. Right now, there is no hard and fast rule that you should if you have the antibodies, but at the same time, the recommendation is that you should.
So I would just like to clarify on that, if I can, Dr. Dhillon, is that we don't know when we are going to be offered the vaccine again in the facilities. And as such, I think if it's safe, I think it's probably important that they do vaccinate now, because it could be 6 to 9 months before they got the opportunity again. And we're not certain if Walgreens will be coming back around to the skilled nursing facilities and when. So would that still stand that they could wait, or would you recommend that they do get
Like
it
I said, it is recommended for them to take it. And the practical aspect of that, as you explained, would be that we have no idea if they want to do it later, how they're going to get the vaccine.
The hope, Daniel, is that taking the vaccine will prolong their immunity more than a natural infection.
Okay. If we're administering the vaccine in the facility, will we be provided the epinephrine for standby use just in case there is a reaction? Monica, I'll defer to you on that one.
Yeah, so the Walgreens pharmacist with their clinics they will have epinephrine with them. We will also make sure that our facility e-kits have the necessary emergency medications available and in the clinic area. But the pharmacists who are going to be administering the vaccines will have EpiPens with them, and they are allowed to administer them if needed for anaphylaxis.
So some exciting news that just got put on the chat. First of all, before the chat, is that I know that Cahokia is scheduled to get their vaccines on December 29th, and Palos just got their notification that they're scheduled on December 30th. So that's very exciting news, just some information to share. Next question, is it okay for a person with diagnosis, I can't pronounce that. Monica, can you help me?
Myasthenia gravis or any autoimmune disorder, yeah.
To receive the COVID-19 vaccine, would the vaccine trigger or worsen this disorder?
There has been no contraindication. Actually, people with underlying medical disorders such as autoimmune process and myasthenia gravis should take the vaccine.
Unfortunately, in the studies, I don't think anyone with those diseases were tested, but I agree with Dr. Dhillon that it's not a contraindication.
Some more good news, Geneva is scheduled to start on January 15th. Are there any more questions that we might have on the chat that the doctors can answer for us? Anybody else have any more questions before we round up? Monica, is there anything else that you want to add about to the facilities and to the team about the process?
Just that we are finalizing our guideline for the actual vaccination process. So that'll be out this week. And just keep an eye on your email. I am sending you guys updates as quickly as I learn them, and trying to get that to you in a concise manner so that it's easy to follow and understand. Always reach out to your regional team if you have any questions or concerns, and continue to notify us when you get your dates for your clinics.
Great. So again, thank you, Dr. Dhillon, Dr. Hines, and Monica for presenting today. Once again, to everyone on the call or on the Zoom, we're here today to encourage you to get vaccinated. You all saw firsthand what this virus does, what it's done to you, and what it's done to your families. We as caregivers, our families, our residents, and ourselves from the disease. At BRIA, we take this responsibility seriously and want to show you that. We're going to be offering a $150 safety COVID vaccine bonus to every team member that completes the two-step vaccine. The vaccine will be out in the next week to 2 weeks in your facility. Your administrator and director of nursing will be giving you the details. Everyone, please help us turn the page on this virus by getting vaccinated. Thank you, everyone, for your time today. We appreciate you and appreciate everything you do for us. Have a great day.
Thank you, Daniel. Have a good day.
Thank you.
Thanks, Daniel. Happy holidays.
Thank you. Happy holidays, everyone.
Thank you.